Is joining us right now, though, is Mr. Marcus Robinson. He's the CEO of United Healthcare, individual and family plans, and this is the season. We've heard a lot about it. We see it all over the place. This is a time to make a decision, but boy, it can be a little intimidating.
Oh,
It can be a
yes.
little intimidating. It's like drinking out of a fire hose. It's just it can be just a little bit overwhelming. And Marcus is joining us today to hear a little bit about exchange plans, and while they might be called different names, how you can find the best and affordable health plan option for your family. Mr. Robinson, welcome to the chat today. How are you doing today, sir?
I'm doing very good. Happy to be here. Thank you for having me.
Now, let me ask you this: how do we access individual and family plans in the marketplace? How do we find our niche? How do we find, because like I said, Chuck is dealing with it. We're all dealing with this. You're inundated with not just phone calls, but TV, emails. I mean, it's just such a glutton flood right now.
Yeah, it can be confusing for a shopper and a consumer trying to find the right plan design that fits their needs or their family's needs. Good thing is open enrollment begins November 1st, so the shopping period is getting ready to open, and you can find coverage by going to the exchange or you could come to us and we'd love to help you as well. We've got resources and a team of individuals to help walk you through those buying decisions to find a plan design that's affordable and that meets your needs.
You know, Medicare was never meant to be all of this. That was literally the one stop beats all. How did it develop into this wherein everybody and his mother's in on the deal?
I think everyone is looking at affordable options and how we bring a couple things to bear for consumers. That's high quality care, that's access to high quality care, and also affordability as well. We focused on a couple things at United Healthcare. If you look at our plan designs this year and going into this upcoming open enrollment season, you'll find that access to doctors are very affordable on our plan designs. So our primary care copays are $0 across our plan set. And we're also offering free virtual care or $0 virtual care, urgent care as well, focusing on medications, low cost meds as low as $5 on many of our
Mm-hmm.
prescription tiers across a network of pharmacists as well. And lastly, just the overall exchange affordability. Many people are eligible for premium tax credit or subsidy assistance. 90% of individuals shopping on the individual exchange do have access to affordable options with additional premium tax credits and subsidies.
Marcus, it seems like this process, it can be a little
Mm-hmm.
intimidating. It can be a little bit much, but it seems like it has changed the landscape and how we're approaching our healthcare. It seems like these plans and these programs really stress more of a preventative kind of healthcare instead of reactive kind of healthcare. Before, is you get sick, go to the doctor, or this happens, you go to the doctor. Now these plans are featuring more things with wellness benefits, access to gyms, access to better dietary foods and things like that, giving actually some people bonuses or credits for being preventative in their healthcare. Is that what the marketplace design was of this, trying to do this type of thing, was more of a preventative and restorative?
Yeah, preventive medicine is really powerful, and also creating and maintaining a relationship with your primary care physician. So you are managing chronic illnesses, but also, preventing or discovering emerging conditions as well before they become very acute. It's the appropriate place to access and maintain your health is through a primary care physician in that relationship. So as I mentioned previously, that is why we focused our plan designs with $0 PCP copays. You've mentioned member incentives around wellness. You're exactly right there. Health is wealth, and we want people to be active. So we're making virtual wellness classes at no cost on all of our plan designs as well through a partnership with OnePass. And there's also additional member incentives on our plans by doing wellness activities and also account-related activities. Consumers on our individual family plan offering can get up to $100 Visa prepaid card by doing those activities.
Marcus, you mentioned it, the money. It always
Right.
comes down to that. Really, always the basics of any decision you make, usually with your family and things like this. How do you access some of the subsidies and make the cost of these plans a little bit more manageable for individuals?
So as you're shopping and you're going to healthcare.gov, or if you're going to our website directly, you can shop for our plan designs there as well, uhc.com/exchange. Once you put in your zip code, your age, and also your income level and family size, those are the components that go into making a determination on subsidy eligibility. That calculation is going to be done in real time during that shopping experience. And you'll see if you qualify for a subsidy, and if so, what amount. What most people also don't realize is there are cost share reduction elements for some individuals as well, depending on their income. That's another type of subsidy where your out-of-pocket costs, your deductibles, your copays actually decrease as another form of subsidization or government assistance on exchange.
So, I mean, can this be leveraged against, or can this be included with an AARP plan, let's say?
So we actually have a partnership with AARP for our members in the individual and family plan offering. It's the discount program for AARP. You can activate that once you become a member, but your traditional AARP plan design is a MedSup plan design.
Okay.
Which is, of course, the different line of business. This is under 65 ACA marketplace plan designs. And to be eligible for an individual and family plan, maybe it'd be helpful for me to explain that. If you do not have coverage through an employer, through Medicare, or through Medicaid, if you live and reside in the United States, those are kind of the key markers for being eligible for an individual and family plan.
Marcus, last question for you. Where can we find resources to make this decision a little bit simpler for us, a little bit more straightforward? What can we reach out and do?
A couple of things. You can visit us on our website. There's a wealth of information on the website. You can also shop and start to enroll November 1st on exchange, uhc.com/exchange. Or if you want to talk to someone live, we've got a team of individuals that would love to help navigate you through that decision-making process. They can be reached at 877-649-9797.
Marcus, along with that, just real quickly, some important dates and deadlines ahead of this.
Yeah, so thank you for the question. Open enrollment begins November 1st. It runs through January the 15th. If you want your coverage to start and be effective on January the 1st, you'll want to make that enrollment decision and enroll by December the 15th.
Oh, wow. Yeah, very important day to Marcus Robinson is the CEO of United Healthcare Individual and Family Plans. For more information, you can go to the United Healthcare website. And the key is ask questions. Don't go uncovered, don't go undercovered, and don't overpay. One of the things you said I think is very important. That zip code is very important because there's different rules and different benefits by those zip codes, isn't it? That's one of the most important steps, isn't it, Marcus?
It is. The plan designs are offered at the rating area or zip code level, and there's multiple options depending on where you live. And so the zip code is an important element where you live when you are enrolling to put that in.
Once again, you can go by United Healthcare, their website, and find out and use some of these resources and these tools so you are getting the best coverage you can possibly get at a decent and fair rate. Ms. Robinson, thank you so much for your time this morning. Great information for our listeners.
Thank you so much. I appreciate being here.
All right, we're going to take a quick break. We're back with more chat on Newsday Amarillo and News.